everyone, and welcome back to yet another episode of Health Unplugged, our superstar, powered by OHA, One Health Assist. I'm your host, and today we are going to deep dive into how artificial intelligence and 3D modeling, 3D planning can take part in the cancer surgery, the field that we all want to explore. This episode is a must listen for all the healthcare professionals, the tech savvy, the technology driven people, and everyone who's interested to know how the landscape of cancer surgery will be changed with the help of AI. Joining us today is the brilliant Dr. Prasad Kasbekar, an expert in advanced surgical technologies related to cancer surgery. Today, together, we are going to unpack few truths about cancer surgery and how 3D planning and AI can help us deep dive into the science and technologies. So let's get started. Hello, Doctor.
Nice to meet you. Thank you.
To kick things off, Dr. Kasbekar, what I would like to first know is how AI and 3D planning can help in the cancer surgery.
So basically, nowadays, results in cancer treatments have improved drastically. And because of that, actually, there is something known as precision oncology, where we do our surgeries with much more precision, much more knowledge, and much more, there is something also known as evidence-based medicine. So when we do a particular treatment, we know what's going to work and what's not going to work.
Okay.
Now, taking all that into consideration, we plan our surgeries in such a way that we use latest imaging in the form of CT, MRI, and all, as well as using this imaging, we create various models, and on that basis, we sort of design our surgeries in such a way that we know that we how much cancer we have to remove and how much normal tissue we have to keep behind to give the best results to the patient.
So, with the basic information you just gave us, my next question is what difference does this make in particularly in cancer surgeries?
So earlier, how things used to work is, when a person was detected with cancer, the surgeries had certain, methodologies and boundaries in which, so like for example, even there was breast cancer, we used to remove the breast, or there were mouth cancer, we used to remove whatever the cancer that was there. But what we noticed is, we there was only a certain amount of cancer. I mean, when we remove the cancer, we have to remove it completely, but we need not remove the entire organ. Sometimes we can preserve the organ, and more or less, even with preserving the organ, it's not just about curing the patient, but also with regards to, we have to ensure that the patient has a good quality of life afterwards. So they should be mentally, physically, and functionally working or normal, such that they can continue their jobs, live in society in a normal manner. So with that, what we sort of went is into AI based reconstruction. Not only are we removing the tumor, especially like in the mouth or the breast or some internal organ, but we are reconstructing that part in such a way that the person looks normal, feels normal, and more important than that, functions normally also. So that is the whole premise of AI based surgeries, where we know exactly how much to remove, and after removing that, we also know how to reconstruct it optimally.
Okay. Now, the connected question I would like to ask you here is what kind of precision will it help in excision of a tumor or in a surgery part?
So I'll give you an example now of mouth cancers, because India is obviously mouth cancer capital of the world.
Prevalent,
So many people will, sort of know who are mouth cancers. If you ever had, a 1:1 with a person who's sort of a mouth cancer patient, you will always see that many of these people, they might be cured of their disease, they might be living long lives, but many of them can't eat properly, they can't swallow properly, they can't speak properly. Basic functions that we take for granted, they can't do. This is where AI based surgeries come in, where we plan it in such a way that we not only remove the tumor and give them the results of a complete surgery, but we reconstruct them, we rehabilitate them in such a way that they can eat properly, they can speak properly. I've got patients, you will realize, you not even realize they're patients. They'll smile at you and you won't even realize they've undergone such a major surgery. So that way. Same thing with breast. Now, many of the breast cancer patients are towards the younger age groups. Earlier we used to think it's only above 60 you get breast cancer, but today we are getting cancer in women as young as 30. Now, the thing is, these women are not comfortable with just getting rid of their breast. They know that they will live a long time. Many of these people survive for 20, 25 years. So they want that reconstruction. They want that looking normal in public. So this is where AI comes into the thing, where we model and we design it in such a way that we incorporate in their surgery that reconstruction, such that once they come out of the theater, they will not realize that they've had a surgery. It's something like
Okay. Let's get more deeper information and ask you some pressing questions. So, what are the key steps that you follow in a procedural surgery with help of 3D model?
So this, since we are doing it, this first thing you have to understand is every patient is different. There is no set protocols to this.
Okay.
But you have to understand, so every person has to be looked at separately based on their age, their outcomes, the kind of reconstruction we want to do, and what we want to achieve. Some, if it's a very aged person, the planning will be different. From a very young person, the planning will be different.
Okay.
But in general, how it works is we first get a very high resolution imaging of the area we want to operate. So let us say now we had one patient who had a chest wall tumor. He had a very big tumor in the thorax, which was involving his ribs, his lung, and outer part of his heart. He went to multiple places where they said surgery is not even possible, you go home. And he was just barely 20 years age. So when he came to us, what we did, we first took a high degree imaging of that patient, where we did a CCT and an MRI scan. We found out, we did 3D reconstruction of his tumor. We found out where his tumor is, how much it's extending, what all organs are involved. Now, AI is not just removal and reconstruction, but there's a lot of physics to it. So, in this boy, how it worked out is removing is one thing, reconstructing is one thing, but he should be able to survive with whatever we have done. So, for example, now in his case, we had to remove 6 ribs. We had to remove something known as the diaphragm, which is the partition between the stomach and the thorax. We had to remove the outer covering of his heart, which is known as the pericardium, and to remove half his lung, because of the tumor size, it was 30 centimeters. So, in that, now we did an AI model. We sort of did a mock surgery on the computer, trying to see when we remove and we reconstruct, what are the physics vectors that are going to play a role in his body. So then we do a physics vectoral analysis to find out, when we remove all this, will his heart be able to pump the blood with the same force? Will his lungs be able to take in air with the same force? So there are a lot of things. We sort of did a vectoral analysis. We had actually tied up with IIT Mumbai with that.
Okay.
And then we did that surgery. So if the basic steps are doing a high resolution imaging, we do a basic mock 3D reconstruction, we do a mock surgery with AI based technologies, we do a mock reconstruction, and once everything is done, we also do a sort of physics analysis to see how much that surgery is going to affect his body and what are the chances that he might have various problems post his treatment.
So, doctor, you've already given us a lot of detailed information on how 3D modeling and planning will help the doctor understand the location of the tumor and how the surgery can be planned. What I next want to know is, what are the risk factors that are associated, and how do you plan the outcome for the patient and the best suitable options?
So I think that has already been sort of answered in my previous in the
Right.
previous question. So basically, AI sort of helps predict what the outcomes of surgery might be. So if you remove this much and you reconstruct it this way, what might happen? It's all presumptive. Obviously, at the end, AI is a computer and they're not experts. But at least we know from our mindset, our perspectives, and we know from a patient explanatory perspective. So we knew what we are heading to prior to the surgery. We can explain it to the patient and their relatives, this is what is the this. So everyone has more clarity. Now from an outcomes perspective, how much will it be better or worse is up for speculation, because everything is evidence based. We need to have evidence to prove it. But it's, I would definitely say that it is enhancing your surgeries, because it we pre-operatively we are having much more knowledge in what we need to remove, how much we need to remove, from where we need to remove, and also when we are making the thing back again, what lengths. So for example, in mouth surgery, doing the surgery is easy, but ensuring he's able to bite with the same physics or vectoral forces to achieve that bite power is the tough part. That is where AI comes in. I can remove the thing, but if he's unable to chew properly,
Right.
like eat an apple, for example, then that is what's getting affected. So this is where AI designs the thing such a way that we redesign we make our cuts, or we redesign the surgery in such a way that once it's done, he can bite without causing fracture of our plastic surgery, and many other complications are prevented.
We accept whatever comes in the way.
Actually, what happens is now in today's day and age, there is a lot of misinformation and lack of information. People don't even know these technologies exist. You know, so that is where many times people are undergoing more inferior
People
treatments.
don't even know these technologies exist. You know, so that is where many times people are undergoing more inferior treatments when something better could be done for them.
Okay.
Now, in terms of resistance or not, people who come to me, usually those who are knowledgeable and understanding readily jump into this because they know that the benefit is there.
Higher.
Some people may not be, having that sort of, understanding. In India, some people don't understand things. There is a lot of information, misinformation. So in that, they sort of get lost. But as such, people who have taken these treatments have really been, happy post the surgery.
A surgery mock that you can actually run through before the actual surgery noted?
So in some surgeries we do something like that, where it is complex, like let's say chest wall thoracic surgeries or complex intra-abdominal surgeries. We sort of do a mock, and then we sort of understand what might go wrong in the surgery. But more than a mock, what we do is that in certain surgeries, like especially in mouth surgeries, we make special 3D printed devices, which are known as cutting guides.
Okay.
So these are like sort of special instruments that are made special for that patient after doing his planning and everything, and we use that during our surgery to get that level of precision. So it's sort of, make it's like a device which sort of tells us where to make our cut in the surgery. Similarly, for the plastic surgeon, he uses that device to design his plastic surgery thing. This is all not to just make him look good, but to ensure that his functional outcomes are better.
Okay.
So that is where the AI comes in.
Okay.
Those are personalized, or are these VR surgeries which you do?
They're personalized. So every patient we check his scans. On that scan, we make a 3D model. Once that 3D model is made, now on that basis, a special cutting guide is made based on, so it's like a multi-team disciplinary kind of meet, where once the 3D model is made, the oncosurgeon, the plastic surgeon, everyone sits together and we decide, okay, this is where we're going to remove the tumor from, and this is where we're going to, this much we're going to remove, this much we're going to keep behind. Then on that basis, the plastic surgeon will put his inputs. Okay, this is what I'm going to reconstruct. All that is then taken. This data is collated by the engineer who comes into it, medical engineer you can call him, and then he designs these devices on that basis.
So the next question I want to know from doctor is, what are the mental or psychological barriers that a patient can go through before they even decide for a cancer surgery?
So there's a lot of, I would say, so there's certain things I don't agree with when it comes to cancer, or rather how cancer is promoted in society.
Okay.
So for example, many people put this thing about cured of cancer warrior. You might have heard of these terms.
Yes, we have heard.
So this is, what happens is you are sort of, tabooing cancer. Like I'll give you an example. Cancer is actually a chronic disease.
Right.
Think of it as diabetes or blood pressure. Now, if tomorrow I tell you you've got diabetes, you're not your world's not going to break down.
Right.
Similarly, if someone tells you tomorrow you've got cancer, your world breaks down. Everyone goes into a frenzy that, oh my god, you've got cancer, kind of a thing.
Right.
And what happens with that now is that many people run behind this, I want to get cured of cancer. Now, because it's been stigmatized so much, there is a lot of hype and, what do you say, fear regarding cancer. Nowadays, cancer, you have to consider it as a chronic illness. Yes, potentially you can get cured of cancer, but there's a potential that it can come back in the future, and you have to accept those kind of realities. Second, cancer is not something that is cured in one day. You come to me, I do your surgery, you're not cured. You need chemotherapy, you need radiation, you need other things also. So what happens now is people are very hyper when it comes to cancer. You have to first understand your disease. You have to understand what your treatments will be and what expected outcomes we are going to expect, from that aspect. Today people are surviving 30 years, 40 years with so-called cancer, because they have sort of accepted their disease. They're doing proper follow-ups, they're doing proper screenings, everything, which, if you come with this whole I am cured of cancer, once someone is cured, they don't want to follow up, they want to bury it under the carpet. So there are a lot of emotional aspects to cancer care, which I sort of think differently too. You have to take it as a chronic illness like diabetes. If your sugar is not in control, you will get complications.
Right.
Similarly, you have to control your cancer. If it's not in control, you will have problems. So this is where AI is also taking a back, because AI is not an immediate process. You come to me today, I can't do a surgery tomorrow with AI planning and everything.
Okay.
It takes a few days to plan, process, design
Yes.
everything and all. And you need to have that patience for it. You need to understand what we are trying to achieve. So these things, this mental sort of aspects have to be sort of changed a little bit.
So with the information that is easily and readily available on internet, what I next want to know is what kind of mindset a patient should have to start with the AI based processing of a cancer tumor.
So first and foremost, once is, when a person is detected with cancer, the first thing is they need to reach the right people. That is something where, because unlike, I would say, cardiac and neuro, where, if you have a heart problem, you have to go to a cardiologist. You
Right.
have a brain problem, you need to go to a neurologist. Cancer is sort of sit still in open field thing, where a lot of doctors, claim they can treat cancer.
Okay.
Now, a simple way is just, how you would know who's the right doctor is look at their qualifications. There are many doctors, senior doctors, who are very good, but if you, as a blanket, just look at their qualifications, whether they have the MCH or DM degree
Okay.
in cancer, that means at least he's qualified, board certified cancer doctor. What happens is many times they go to other doctors, a lot of other procedures are done, and that sort of, makes the outcomes worse.
Right.
Because your first procedure is always your best procedure, kind of a thing. Now the thing is, once you come to that doctor, that doctor, put your faith in that doctor, because many people will come, some uncle will come and say no, meet that doctor, some aunt will say meet that doctor, and everything becomes a mess. Your treatment has to be very streamlined and straight, and properly designed for the best results.
Okay.
If you try multiple things from multiple places, it becomes a khichdi, literally. So these are the two things you have to sort of keep in mind: reach the right doctor and follow that doctor's treatments. That would be the best way to get the best results in cancer. Many times people associate cancer as a very expensive disease,
Right.
because obviously, there is surgery, there might be chemotherapy,
Chemotherapy.
there's radiation, there's a lot of this thing. So that is where, and obviously cancer is a team based disease, and not a single doctor will treat you, but a team, right from your surgical oncologist, medical oncologist, radiation oncologist. You'll need physiotherapy, you will need
Right.
psychology, you'll need speech therapy. So a lot of people come into your planning, kind of a thing. So in that scenario, you should understand two things. One, there are many government aided schemes and all which help you sort of in your treatments.
Okay.
So there you can take, I mean, going into that will just take a thing, make it too long. But there are government agencies and all that help you. Second is, understand your full disease and your treatment firsthand only. What treatments you will need, what this thing. Because many times people, when they come initially, the doctor says let's do surgery, and you happily do surgery in the best room of the best hospital, spending a ton of money, and then the doctor says now you have to do chemo, and now you have to do radiation, and then patients come like, I don't have any money left. So you have to understand your disease properly, choose your hospitals wisely, choose your doctors wisely, and you can get through this with excellent results.
So that was a thorough, detailed explanation on how a patient can select the doctor, the hospital, the treatment, what are the different options available, what are the government agencies, how they are helpful to underprivileged patients. So that was really great, doctor, to know that these kind of options are available, because in chronic diseases like cancer, patient actually gets really worked up not just because of the disease, but because of the financial barriers as well. So that was really great to know that. Thank you, doctor, for the detailed knowledge and explanation on how patient can explore different options available and different kind of stakeholders, the doctors that are involved in a cancer chronic disease. So, like Dr. Kasbekar, so we have best oncologists like Dr. Prasad Kasbekar on a platform, so patient can directly book for virtual consultation on a platform. Let's ask a personal question. So, what inspired you, doctor, to be a surgeon? Specifically an oncosurgeon.
I would say very much my journey became that way. So when I was in school, actually I was very good at physics and mathematics,
Okay.
and my bio was a little bit slightly on the weaker side. So for me, it was like I always have this inner thing of doing. It's like I want a challenge, where I want to do something different, or go try and target my weaker thing, kind of a thing. So then that's how I went into biology.
Okay.
And then when I went into biology, I sort of liked the field of medicine. I have no doctors in my family as such. So it was all, about, and obviously being open category and all those other things. I found it a challenge of trying to crack that medical entrance exam.
Okay.
So we, with my friends and all, we sort of just, gave the exam and somehow cracked it. And that's how I entered medicine. Now, when the initial part was when I was doing my MBBS, I always wanted to be a heart surgeon.
Okay.
Kind of a thing. And I sort of, after finishing my MBBS, I interned in Bombay Hospital under one very senior cardiac surgeon. Okay. To see how heart surgery is. And to be honest,
I found it very simple and quick. I mean, not to play it down, but it was quite easy. I mean, so that is when I said, like, I just wanted to do something more challenging. I wanted to always do surgery.
General surgery. And in that, when I was doing my general surgery, we used to get a lot of cancer patients. I did it at Pune, BJ Medical in Pune, and we used to get a lot of cancer patients there. And cancer was the one field over there where all the doctors or the surgeons were very sort of nonplussed, or they didn't know what to do, kind of a thing. They could manage everything else, but cancer was the one field where everyone was putting their hands up. And that's how I said, okay, I want to do something in this.
Okay.
So that is how my journey started into cancer. Then I went and did my MCH in Gujarat, where we sort of get a lot of mouth cancer and all. So in Gujarat, when I went there in Ahmedabad, I did my MCH. So there we used to see a lot of mouth cancer patients and operating and all that, but many of them were cured, but they had all these problems of unable to eat and this and that. So that is where I got more interest in all these AI technologies. So I had the great opportunity of going to Korea, where I did a small fellowship, and there I found out how they were using robotics and AI and all in their treatments. And that is how my journey reached there, where I realized that that is something I want to bring to India. There are very few centers, I think, in India. Maybe there's a center in Bangalore that I've heard of that is doing this AI-based treatment. But other than that, I've not heard of any centers in the country who are doing these kind of treatments.
Okay. So that's your super specialty is?
Yeah, so my niche would be into AI-based treatments, all kinds of cancers.
So that was really great again to understand a journey of an oncosurgeon and how technology can actually interest a doctor to get into AI and robotics. So thank you for that. To ask a question related to the treatment and from a patient point of view, what is the general cost of a surgery?
Cancer surgery. So, see, this is a very, very difficult question to answer from 2 or 3 perspectives. Now, you must be knowing that cancer is not one disease. You can get cancer right from your head to your toe, and every surgery is different. Even in the mouth, the kind of cancer surgeries can be like 8 or 9 different types of cancer surgeries based on where that tumor is, how much it has spread, and things like that. So the budget can be extremely variable. But what people need to understand, one is, if they get detected early, they come earlier, obviously their treatments become much cheaper, because many times surgery, chemotherapy, radiation even might be avoided post your treatments because you've got it in the early stage. So obviously, if you're coming early, your costs are less. If you're coming later or ignoring your disease, your costs go higher. Second thing you must understand is that it all depends now on how you plan your business. The same surgery in one hospital might cost you 10 lakhs, in another hospital can cost you 2 lakhs.
Okay.
So it depends on where you do it, which doctor you do it, how you do it. There are too many factors in that. But you must understand also that the government of India has done a lot of steps for people who are not affording. There are a lot of funds, like for example the chief minister's fund is there, that funds actively patients coming to doctors like us who are certified cancer surgeons.
Okay.
So if we are certified, the government funds our patients into getting
Getting
better treatments, because
treatment.
the government also wants the patients to get better quality treatments. So there are a lot of schemes, there are trusts, there are a lot of ways to help people. Only people need to be more aware about it.
So here, what I want to take home is to pay attention on your body, and early detection is an early cure, as you saying. So pay attention to your body, and if there are any signs or symptoms that are unusual to your body, we should get in touch with the doctors, and they will help us to cure. So, listeners, what I want to emphasize here is for a preventive measure, you can book a full body health checkup on our One Health Assist lab test panel so that you have an early detection of any chronic disease. So, the next question I want to know, sir, is which was the toughest surgery you have done so far, and any surgery that you think you can share with us?
So I would say not, I mean, toughest. We have done a lot of surgeries which have been extremely challenging.
Okay.
We've operated like major surgeries in 90-year-old people and got them out and fit and healthy. But I think one surgery which really will be close to me is one patient who we had operated. I told you of that chest wall tumor.
Yeah.
So this young boy, 19, 20-year-old boy, actually came to Mumbai from UP, I think Varanasi, and he went to most of the hospitals here. And when he went to these hospitals, including some top cancer hospitals, they told him that he has 6 months to live,
Okay.
and this tumor is just spread too much, and there's nothing that can be done for it. So what happened is, then searching, he somehow came to us, and we finally did all his planning and everything. And we actually told him that surgery might just be possible for you, and you might just come out of it. So they actually spent around a week or 2 weeks, they didn't come back, because they thought I was selling them dreams. I was
Okay.
not, because 3 or 4 top hospitals I've told them nothing is
Nothing.
possible, he's not going to survive. And this guy who's just suddenly told me that I'll get you out and make you fit and healthy, they were just thinking that I'm just trying to, I don't know what they were thinking. But anyway, out of desperation, I think 10 days later they did come back saying that we've gone everywhere, everyone's told that there's no chance for this boy. You're at least giving us a 5
Hope.
to 10% chance, let's say. I told them what was 50% chance, but they were like, we'll take it to 5%. Even that 5%, let's work on it.
Okay.
So then we planned his surgery, we did everything as I explained
Right.
earlier. And today this boy is now an IAS coach. He's 3 years post his surgery.
Wow.
And he's absolutely doing things like swimming, he's giving talks, he's studying for IAS, as I told you. And yeah, so he's cancer free. So this is something we really, you know my motto has now become, so earlier there were mottos that if the prognosis is looking slim, don't get into it. Some doctors think that means why this thing. My motto is, even if I can give that person a 5% chance of doing well, I will jump in.
Okay.
Kind of a thing, because this has been sort of like a success story where I can say that sometimes yes, when things look grim, we can get them out.
So that's really fascinating to know about a patient's journey with Dr. Kasbekar. So what I want to again stress here is technology plays a very important role. So I would request all the listeners, all the viewers, if you want to get in touch with the best oncologist in Mumbai, please get in touch with Dr. Kasbekar on our platform. So the next question I want to know from doctor is the number of surgeries that he would have taken in account so far. So how many surgeries on an account you would have done, sir?
So I have been a practicing cancer surgeon right from 2014.
Okay.
Means from 2014 is when I became a cancer surgeon, and I started my practice in oncology training and all. So from that date till now, it's been like 11, 12 years. So I would say a good 3, 4 thousand, maybe more than that.
Okay, that's a huge number, I would say. We have seen how the technology can transform the OR and how the cancer surgeries can be assisted in a technology-based model. But do you know, doctor, how we can use the technology to transform the healthcare? One Health Assist is an all-in-one platform where we can have consultations, we can have pharmacy booked, we can have lab reports done, and the most important part is the One Health Locker. It's an organized way to manage all our medical records. So it's an easy way for a doctor like you to access the patient record, and for a patient, it's an ease of carrying the medical record in a digital format. To the listeners, I would say One Health Assist is a complete ecosystem where you can have your virtual consultation with doctors, all specialty doctors. You can book your lab test, you can have the medical subscription or the medicines can be booked, and we have One Health Locker. So all your medical records can go in a digital format. So with One Health Locker, a patient or a consumer can manage all the medical records in a tabular or a digital format. So, doctor, what I want to know from you is how a platform like One Health Assist and a One Health Locker will be helpful to the consumer, patient, and to doctor like you.
So I think it will be very helpful to us more than patient and other people, because what happens is, especially in cancer, many patients come with multiple treatments and all kinds of procedures. Many histories are not known, kind of a thing. So if you have all this tabulated in some sort of a cloud, service, so then you can get all their history, all their data. Many times, some patients or their relatives don't know what's happened to the patient earlier. So if all that is put on cloud, I think it will be very easy for the doctor to access, so we can get a proper picture of what our patient is and what's been done with the patient.
So that's exactly what One Health Locker is all about. So I would request all the viewers and listeners to come on our app, book online consultation, and start using One Health Locker. It's really going to be very beneficial to you. Sir, what I want to know next is how is this platform beneficial to you in terms of managing your e-clinic or managing your patient management?
Many of my patients are chronic, so they keep coming for a very long period of time with multiple things happening with them. So I think this platform is very good because it keeps a proper data of all my patients, what was done the last time, what was prescribed, as well as helps me in organizing appointments and things like that. So yeah, it's a very good platform.
This brings us to the end of the podcast. So thank you, Dr. Kasbekar. It was really nice interacting with you on cancer surgeries and how technology can play an important role. For our listeners, stay tuned and please subscribe to our channel and tune in for more such informational videos.